Hello everyone, my name is Dr. Karan Shetty. I'm a board certified plastic surgeon from Bangalore, India. Today we're going to be talking about why people are afraid of surgery and what are some of the reasons that makes them hesitant in terms of getting their procedure done. First things first. First, a well-informed patient is always, almost never afraid. Some amount of nervousness before a procedure is always good. Being overconfident or being too nervous is not a good thing. You have to be somewhere in between. You have to be in that sweet spot because you know you're going to do something important, but at the same time you're not too nervous to not undergo it. Neither are you overconfident that you think that everything is going to be hunky-dory. It is a process and the process has to be followed. So the few reasons, let us start with anesthesia. Some people are afraid of anesthesia. What kind of anesthesia they are going to get? Most of the time with the kind of technology we have, the procedure itself is completely painless. It can be done under local anesthesia, spinal anesthesia or general anesthesia. With the last 130 years of progress of anesthesia itself, the pain, the intra-op, the post-op, everything has become so seamless. So you're lucky to be in a time where things have progressed so much that you're in a position where anesthesia itself is almost always safe. So that is one of the times when people feel a little anxious about the procedure. The second thing is always the procedure itself. What kind of procedure they undergo, what kind of post-operative pain that they will encounter depending on the sensitivity of the patient. Those are the two next important factors that prevent people from getting the procedure done. The procedure itself, depending on what it is, you will have a complete idea of A to Z of the procedure. So the easiest way of overcoming fear or anxiety is knowledge. Once you are you understand the procedure yourself, you understand the concept yourself, which means you are understanding what is going to happen to you completely. Once you have the knowledge, then you know that you can go ahead with the procedure. Like with anything in life, knowledge is power. And the more knowledge that you get out of the procedure, the more you understand, the more you're prepared mentally, physically to undergo what you're going to undergo. The next thing is pain. The pain itself with any procedure, like we said, we never sugarcoat it in telling people what kind of pain they will undergo. Yes, it is a procedure, pain will be there, you have to be prepared for it. Having said that, at the same time, with the kind of medication that we have, the kind of injections, tablets, anti-inflammatory drugs that you have, the pain is reduced. It's not zero, but it is reduced. Reduced to an extent that you can be comfortable with the knowledge of the procedure and with the knowledge of what you have. The next reason I think people are sometimes hesitant about a procedure is the kind of lifestyle we have, the kind of work we have nowadays. People are not able to take that kind of time off, the amount of time, the amount of this away from their work. So that is another reason why patients tend to delay their procedure despite having a requirement for it. For this, I would say only one thing: if you want anything in life, you will get it. So it depends on the amount of dedication, the amount of perseverance, and how badly you want the procedure. So if it is a procedure that you want really badly, you will do it. Like I said, most of the things that I have spoken today about the anxiety or being afraid about a procedure can be completely allayed as long as you understand your procedure well, you speak to your doctor well, and this entails to not only plastic surgery. This is related to any procedure in the body, any surgical procedure, any medical procedure, or anything that happens to us health wise. If you are able to understand it, that is the first step in moving forward on this journey called life and health. Thank you so much.